Hi, welcome, Linda. Who is this? Winda, Keyshawn, Puma, Gucci, Lori, Carrie Ann. I don't know who is here. C3 person. I think I call about 10 names. And hi on YT. How are you doing? Welcome. I'm just sharing up the live a little bit. See who is available. Want to come and spend a few minutes with us. Yeah. All right. So how your weekend went? How is your Monday going? France, welcome. Why am I decide to start itching me as soon as I come on the live? Shamir, how are you? Karen, welcome. Melinda. Flying Kings, hi, how are you doing? Remember to go ahead and share up the live, guys. That would be nice. If you haven't followed us yet, I would love for you to go ahead and follow the page. You can also subscribe to my YouTube page, I Think Nursing, for additional content. All the live streams are posted over there or stream over there. Shells, Wagwan, what's going on? Yeah, we're gonna do some questions tonight. How your day? How is the weather in New York? Oh, you're off today? Okay, nice. I went in, it's freezing. I saw it. I think I saw where it was like -3. Lord, I'm not grudging no. I don't grudge no one bit. The temperature down here is what? I think it's like 39 degrees or 41 degrees. It's cold, but it's workable. It's doable. Hi, Michael. Welcome. Jonal, welcome. Welcome, guys, on YT. I see 17 persons. I'm Stacy. Welcome. I'm a nurse. We're going to do some studying tonight. So feel free to hang around. You can subscribe on Wheel and come again if you decide to leave. All right. Make sure you subscribe so you can come back to the video later on. You're in Argentina. Okay, nice. Fernando, welcome. Ater, you, let me say it back at you, welcome to the page either way, but there are other pages available, so feel free to move along if you don't like this page. All right, Patrina, welcome. Moko, Julia or Joella from UK, welcome. Nana, welcome. All right, so today is not my usual day that I normally go live for nursing questions. I normally do Tuesdays and Thursdays at 7 p.m. Central Standard Time. But today I'm a little bit early from work and finishing up some stuff. So I said, all right, let me just come on and do some questions. I dropped something. No, I never have anything in my hand, Sir Mod. Thank you, Moko. I am doing good. I'm doing good. Where are you joining in from? Let me see. I don't know. I don't know what that is. Okay. Yeah, but I hope you guys are doing well otherwise. I know it has been a very long weekend. That's how it felt for me. Oh, you love Afro? Okay, Fernando. Okay, thank you. I'm draining from Papua New Guinea. Okay. Welcome. What time is it for you now, Moko? Miss Wright, welcome. If it's the first time you guys join in, if you don't mind, go ahead and just tap up the live, double tap your screen. So double tap your screen on YT just to give the video a thumbs up. That would be really, really appreciated. And on YT, on TikTok, I see a few persons here. Let's just work the little finger a little bit. This finger on the screen, it's not gonna hurt. It's just gonna help with preventing a little arthritis. You know them way there? Yeah, man. Let's just work the finger for a little bit. I remember to go ahead and share up the live just to get other persons over here. That's all it's doing. Sarah, welcome. Let me see what message is this. All right, enjoy your evening, Dim. Let me put out your light because you're too bright. You're too bright right about now. All right, so enjoy your evening. Hey, Omo. Thank you, Jonah. So I did it yesterday. Well, I've been doing it since last week. So I finished it yesterday. Took a few hours. So this took about 12 hours to wrap it. So I did the 3-strand plait and then I wrap it yesterday. I'm doing good. My country is doing as best as, possibly can. I'm originally from Jamaica, so I'm assuming that's where you're talking. But we have a page where you can go and assist with donating. It's a Support Jamaica. So supportjamaica.gov.jm. Because of the hurricane that passed, we have a few persons that are in need of certain things. So feel free to do so. And in my description box, the description on my YT page, there is also a GoFundMe page. If you want, you can also, support that as well that I created. Yes. All right. Let me turn the camera so we can do a few questions tonight. Oh, forgot it up that side. Can do a few questions before I go. Okay. So they're gonna be like about 10 multiple choice questions, and then we'll do some case studies. Probably about 2 case studies. I'm only doing 1 hour tonight though. Only 1 hour we're doing tonight. Sometimes I can't find the cursor. Where is it? Okay. Hi, Warren. Crazy Ree, thank you for that gift. All right, let me turn this thing around so you guys can see the screen. Flip camera. Let's see if it is. Okay. We'll do that one. So these are some 10 questions just to start. Fire Khan, welcome. Thank you for joining in. How many persons? 5. That's all? 5. 4. 4 persons, journal. 4 persons. All right, let me go ahead and turn the camera so you can see the questions that we're doing tonight. So all you need to do is save the patient's life by choosing an answer. And then from there, okay. Danny Sue says C. Welcome, Danny Sue. Let me put this up. Okay. Massey, welcome. All right, so let's get cracking here. Shell says she don't know. Choose one, Shells. Choose one. All right, guys, I see 10 persons on the live. Can we tap up the live? Can we try to tap up the live a little bit? I know when we start the questions, we're not going to be able to tap up. We're not going to tap the screen because we're so into studying. But please, may I beg you, just share the live. Let's try to see if we can share it about 5 times, 10 times, 15, 20. Just share up the live. Let's get some likes on the live. This is just going to help with pushing it out to the FYP page. That's what I hear the young ladies always say. And not only that, yes, we want to get other persons over here, make the live a little bit more fun. 14 persons, yes, but we love crowd. Today's the day we love crowd. Today is the day we love crowd. So let's draw some more attention over here just by sharing and liking up the live. Thank you, Seda Jolu, for sharing up the live. Barbie, welcome. Can you drop a heart if you're joining me for the first time here? Okay, Denver, thank you so much. Thank you so much. Below, welcome. I think this is the first time I'm seeing Below. Jesse, welcome. User 83, Louis G, welcome. Anthony, welcome to the page. Remember to subscribe and follow. You can also follow on TikTok at Think Nursing and on YouTube at Think Nursing. Yes, it's for RN below. But if you're LPN, it will help you as well. It will help you as well. Ewan, James, good afternoon, good evening to you as well. Oh, so my channel is about nursing, travel, lifestyle. I do a lot of, I talk a lot about nursing. We do study sessions on Tuesdays and Thursdays at 7 p.m. But I know today is Monday, but I do pop up live streams as well. So any information you want regarding transition into the state here as a nurse, I'm an international nurse, so I talk about that. I talk about being a nurse, a registered nurse here in the States, Jamaica, being a nurse practitioner, the whole 9 yards. Okay. Yes, I'm from Jamaica, Anthony. Rosie, thank you for sharing up the live as well. Bella, welcome, welcome. I remember to do your daily heart meals as well. I'm in Canada trying to get into nursing as a Jamaican. Okay, nice, nice, nice. Excited for you. Well, make sure you subscribe to the page so you can enjoy, the study sessions we have here in the evenings, and based on the contents that I post, it will benefit you. So subscribe to the page. She's so pretty, Shan, welcome. ML, welcome. Oh, it's PSW. PSW. I'm not so sure what you're talking about, James. All right, so the first question, a client with a chest tube to suction has no tidalin in the water seal chamber. Which action should the nurse take first? A, clamp the chest tube. B, check the lung expansion on the latest chest x-ray. C, assess the kinks or dependent loops in the tubing. Or D, increase the suction level. Where's my glasses? Jesus. So you have a client with a chest tube to suction that has no tidalin in the water seal chamber. And no tidalin, or tidalin means, when you talk about the rise and fall of the chest wall, just like that, with the chest tube drainage, the water, it's the same like, the rise and fall we're talking there with that water. So it has no tidalin in the water seal chamber. Which action should the nurse take first? A, clamp the chest tube. B, check lung expansion on the latest chest x-ray. C, assess for kinks or dependent loops in the tubing. And D, increase the suction level. I see a few persons say C, assess for kinks or dependent loops, because no tidalin can mean the tubing is obstructed or the lung has re-expanded. Always check for a simple fix first. So always look at your equipment. Assessment is very important. So always start with that first. Addis, yes, always assess. Love Machine, welcome. Taxi Cap, welcome. I see Tashi says D. Tashi says D, increase the suction level. So try to remember what Tidalin is, and then from there, okay? So increasing the suction level and you're not having any Tidalin is not gonna, fix the problem. That is gonna make the situation even worse for the patient. So if there is no Tidalin, if there is kinks, then this is putting the patient at risk for, like tension pneumothorax itself, the buildup of pressure in the chest wall. So go ahead, check for kinks, and then from there you can do your further checks. A client with type 1 diabetes is found confused and sweating. Blood glucose is 48 milligrams per deciliter. What is the priority action? And once you know what priority means in terms of NCLEX world, you'll be able to answer most of your questions, because you're going to be addressing the pathophysiology of the condition itself. So what is the priority action when you're talking about a diabetic patient here who is confused and sweating? What is it that you need to do to help resolve this problem, the sweating and the confusion? Give 1 milligram glucagon IM. Give 15 grams of rapid carbohydrate. C, call the provider. Or D, start an IV and give a D50. I see A. Okay. So I see how many persons? B, 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 A, A. All right. So A says give 1 milligram of glucagon IM. See a few persons says that, and then B is the next option. Didn't see D at. So remember, the patient is confused and sweating. Glucose is 48. So is either 1, start your IV dextrose, give your 15 gram, give your IM glucagon, or call the provider. So with your 15 gram, that is oral. So if conscious, then you give, yes. So 15 grams is going to be for your oral, orally. If the patient is confused, you want to bypass that one because it's going to be at risk for aspiration. So go with your B. If the patient is awake enough to swallow, give oral glucose first. So this patient is confused and sweating. What is the priority here? Give the 15 grams of rapid carbohydrate. So depending on, yes, Siggy. Vanille. So the patient is confused and sweating. So go ahead and get that started. The IM glucagon, you can give the IM glucagon. You can do the IV. But if the patient is, sometimes the patient can be confused, not to the point where they're totally out of it. So based on your assessment, then you decide, okay? But you need to be giving some carbohydrate, glucose to this patient. That's why I say if the patient is awake enough. So, all right. So if the patient is awake enough, then you can go and get them the oral glucose. You can do D if they're confused. So D, D and B, if you're confused to the point where their airway is at risk. So the IV is good for D, and the IM is also. So both of these are good options, D and B. I think IV push glucagon would be best. I know it's not an option, but just a suggestion. Okay. So they have the IM and they also have the IV. So both of these are good options for the one that is having problems with their airway, if they're confused to the point. But seeing that these are almost similar, both of these are going to be for your confused patients who you definitely want to keep NPO. So the next option would be this one, which, as I say, they said that the patient is confused and sweating. Blood glucose is 48. It didn't really say the extent to how to which the patient is confused. That's where it gets so challenging. Yes. All right. So just make sure you look at the options and see if you have two similar, you're only supposed to choose one, then more than likely those two are out of the way. They want you to start with the simplest things. So you're going to get some food and give it to the patient. You say C or D. Denver says C or D. Okay. I got to go, but I will give you. Okay, no problem, Denver. Thank you so much for stopping by. So, Mila, welcome. He will aspirate if we give B. And then remember 15 grams, but he's confused. So, A. Okay, could be A, could be D. But both of those are similar for your confused patient. So, Michaela says C. We'll go with B. So a patient is 1 hour post PCI, percutaneous coronary intervention. The nurse notes cool, pale right foot. So what is going on? What is going on with this patient? What should the nurse do first? A, document the finding. B, elevate the leg. C, notify the provider immediately. D, apply warm compress. C, notify the provider immediately. Why are you going to talk to this provider regarding this patient and this leg? What comes to your mind? What are you thinking is happening? Kirsten, welcome. Thank you for following. Ischemia, arterial occlusion, clot. Yes, Sarah, welcome. So this patient just had PCI, so this patient is at risk for clot. So you want to notify the provider. All right, because the cool, pale right foot is suggestive of arterial occlusion. So post-PCI emergency. Documenting the finding is very important. Elevating warm compresses. But this is very important for the provider because more than likely they're going to have to start this patient on some blood thinners. And then from there, hypoxia, blood flow is altered. Exactly. A client arrives with sudden right-sided weakness. Don't want to elevate because that's even less blood flow to the foot. Okay, Michaela. A client arrives with sudden right-sided weakness. Last known well time was 3 hours ago. Which test must be completed before thrombolytics? A, EKG. B, CT scan of the head. C, CBC. And D, coagulation panel. Sure. Teresa says CA. So a client arrives with sudden right-sided weakness. Last known well time was 3 hours ago. Which test must be completed before thrombolytics? A, the EKG. B, CT scan of the head. C, CBC. Or D, coagulation panel. I see B, nice. B, yes. Why you want to get the CT scan done first? Because you need to know if hemorrhagic or ischemic, Michaela. Thank you for that. So CT scan is mandatory to rule out hemorrhagic stroke before giving TPA or TNK. So you want to get that done. The others are very, very important, but in terms of as it relates to your thrombolytics, because you know that is a blood thinner. If the patient already has a bleed, we know that is contraindicated. What are some contraindications to give in thrombolytics? Teresa says A. No, it is B. Because remember, this is a blood thinner. The thrombolytics is a clot buster, Teresa. So active bleed in pregnancy, yes. Anticoagulants. Hemophilia. 185 or 88 BPM past is with bleeding, yes. A recent surgery. Up to 3 months. Your emergencies, your hypertension. Okay, nice. While giving meds through an NG tube, the nurse meets resistance when flushing. What is the best action? So you're putting in the NG tube and, well, you've put in the NG tube, you're now giving medications and you've met upon some resistance when you're flushing. What is the best action? A, push harder with a syringe. B, reposition the client and try flushing again. C, remove the tube immediately. D, crush the meds smaller. Let's see, B, C, Niche says C, Bella C, remove the tube immediately. Okay. B, reposition the client and try flushing again. So the tube may be against the gastric wall or kink. So just reposition first before pulling it out and then put the patient through trauma to get it back in. So reposition the client and try flushing again. So you're feeding through the NG tube. You met upon some resistance when flushing. Just go ahead and reposition. Do not remove the tube immediately. Assess, and then from there, once you do your assessment and do your checks, then you can decide. Crush the med smaller. You're having some resistance. So crushing the medication smaller is not going to get past that resistance. You have to know why the resistance is there. Push harder with a syringe is not going to even, you probably cause more harm for the patient. So reposition, assess, and then from there you do that. The answer is to listen to the doctor. Katran, welcome to the page. No, the answer is assess your patient first. Do you have one-on-one? No, I'm not doing any one-on-one right now, honeybee. I can do small groups. So you can inbox me. We can talk about that. Emmy, yes, we're doing questions that are similar for NCLEX. I'm currently in Jamaica, not in Jamaica, in the US, but from Jamaica. All right, a pre-eclampsia patient on magnesium sulfate has a respiratory rate of 10 breaths per minute and absent deep tendon reflexes. What is the priority? So what is preeclampsia? What is preeclampsia? Hi, Millicent. Welcome. Wagwan. Hypertension during pregnancy. Proteinuria in the urine. Yes, Michaela. High blood pressure in pregnancy. Nice. So you have a preeclampsia patient on magnesium sulfate, has respiratory rate of 10 breaths per minute and absent deep tendon reflexes. What is the priority? A, stop magnesium sulfate infusion, give calcium gluconate, C, apply oxygen, or D, call the provider. So D, call the provider, apply oxygen. So I see a few A's, a lot of A's, which is to stop the magnesium sulfate, and then from there you do everything else. So early step is to stop the medication because it's causing toxicity, and then the antidote comes next. So you go ahead and stop the magnesium, and then you give your calcium. Okay. This patient is on that. Okay. And I think I saw a few persons put some other things. Excessive headache, proteinuria. So Michaela says high blood pressure in pregnancy is just gestational hypertension unless before 20 weeks gestation. Presence of protein is preeclampsia. Yes, I was going to ask the classic signs of or signs and symptoms of preeclampsia. And what's the difference between the preeclampsia and the I don't know why some app says first give antidote. You have to stop the medication because the patient is respiratory rate is low, so their respiratory depression going on, and they also have absent deep tendon reflexes. So you have to stop that. What is it? Okay, so preeclampsia, the presence of protein, then eclampsia is the tonic-clonic seizures. I saw this question before on someone TikTok review. The person said you have to give calcium gluconate. You will give calcium gluconate, but what is the priority? Oh, Barbara, I see what you're saying. I see what you're saying. Okay. I see what you're saying. Okay, I see what you're saying. Yeah. Because I always say the priority has to do with, okay, so just think of it with preeclampsia here, it's causing because you have too much on. The first action is going to be to stop the magnesium. The priority is you're treated, just think of the pathophysiology behind the preeclampsia and how the patient is developing, the absence of their deep tendon reflexes. Why the patient is low with the respiratory rate. So you're addressing the pathophysiology of that part, all right, of it. And in order for you to answer your priority addresses what is the thing that is going to help with reversing the absent deep tendon reflexes and this based on the pathophysiology. The calcium is going to help with that. But the first action is to stop the magnesium sulfate. So I understand what you're saying because that's what I keep on saying. You can't give calcium while the mag is infused. No. You can't give calcium gluconate while the mag is infusing. No, you can't. But I see what she's saying here. So the early steps to stop the magnesium, and then you give the antidote. So stop first, then call provider since the calcium is not ordered. In the real world, calcium is ordered for your, for in the NCLEX world, we're saying Thea as the antidote. But I see what you're saying. Who was that again? It depends on the first option wasn't there, then B. We know the patient will need that as a PRN. Yes, geopsy. Okay. What did I have for the answer? It's always stop if there is an at first. Yeah, so you stop it. That's the first action. The first action is to stop it. But the priority is to make sure that patient gets the calcium to help with reversing the respiratory rate and all. We were arguing to her that you have to stop, but she said no. I was talking about, yeah, so the priority, you're correct, Barbara. So the priority would be for the patient to get the calcium to address the underlying problem, which is the hypomagnesemia. So you have to address that as a priority. Just think of it. You have a patient that has, is, let's try and use one. Let's try and use a sepsis patient. You have a patient that is in sepsis. The patient is hypotensive. The patient is going to need the fluid. The patient is going to need the antibiotic. But in your mind, you're saying that, oh, the priority is what? The priority is going to be the antibiotics. That's what you're thinking because the patient is in sepsis. But if you understand the pathophysiology behind sepsis and the evidence, based on what the best practice is, the answer or the first thing in sepsis management is make sure you get that fluid going because of the massive vasodilation that is happening with your sepsis. So you want to make sure that you're perfusing properly. So that is the priority for that patient. So you have to address the underlying pathophysiology of whatever is going on. And then from there, you are able to identify priority. And then when it talks about best action, what is it the first action, what is it that you're going to be doing at the bedside? You have a patient that is short of breath and they're lying flat. What is the first action? Oh, put the head of the bed up in a high Foley's position. But what is the priority there for that patient for the shortness of breath? The patient needs a little oxygen. So you get the oxygen on. That is priority. But the first action is to position the bed in order for the potassium to go into the cell. Okay. So let's go on to this one. 7. A client with AKI, acute kidney injury, has a potassium of 6.0 milliequivalent per liters and peak T wave. The nurse should prepare to give A, furosemide, B, sodium polystyrene sulfonate, C, IV insulin with dextrose, and D, sodium bicarbonate. So what's the answer here? C, 7, so I see C in order for potassium to go into the cell. So what's the answer? So yes, we identify this as hyperkalemia. You have the peak T waves, which is classic to your potassium here. I see tons of C's, and then so we have your insulin and dextrose rapidly shifts potassium into the cell that is most urgent. So back to the same thing that we were talking about earlier. So well, they don't have it on here. Why not B? B is an oral medication. So if you give B, it's not going to be effective right now. So this is the same as like your Kayexalate. It's not going to be effective now. So you realize that this patient is having peak T wave. You know that this is very critical. Their potassium is critical. So they're at risk for arrhythmias and all. So you wouldn't want to go ahead and give them polystyrene to sit down and be, waiting a couple hours before they start having a stool to help with getting rid of that potassium. We want something that is going to work. No. And what is going to work is your insulin, because that is the transport. Just think of that railway track. You have the railroad, and then you have the train on top. So it's the same thing. In order to get the potassium out of the cell, to lower those T waves as well as the K, the potassium, you need your insulin. Those are the two important things. What if you had calcium on calcium as an option? Would you have still kept your insulin with your dextrose, or would you have chosen calcium? Who would have still kept insulin? If you had your calcium here, calcium, and this goes back to the same thing we were talking about. So you have your calcium carbonate here, calcium gluconate rather, sorry. So you have your calcium gluconate here, and this patient presents to you, which one of them would you go to first? What is the priority here? IV always the most ideal if it's an emergency. Yeah, it is. So this is IV as well. So we have 2 IV here. So if you have this patient and you're supposed to give this patient the medication, we know that the patient needs the calcium gluconate and the insulin with the dextrose. Which option would you give? So Clixie 123 says C, the IV. Aisha says B. RMG says B. Okay. B to save the heart. So it's the same thing we were saying about the other option, the other question earlier. All right. Why do we give calcium? We give calcium to protect the heart. And why we give insulin and the dextrose? We give it because we're addressing the potassium itself. We need the potassium to be lowered. So you give this to transport. You give the insulin to transport. So the priority here is the insulin. The insulin with the dextrose, that is what is needed to push that potassium into the cell to get the number down. That is important. Your calcium gluconate is to protect the heart because of the effects of your potassium. Okay, but C is the one that is that is going to help with lowering. You can give all the calcium we want in the world. If you're not giving insulin and the dextrose, that potassium is just going to be climbing. So C to get the potassium. Exactly. Drop potassium in Z. Exactly. So you need that. So when we went, so this question that we were talking about, let's just go back to it. If you understand this question, if you understand the rationale behind this, as I say, the patient needs the calcium, the patient needs the insulin. But based on the action of the insulin and the calcium, which one is gonna work on getting the potassium lowered? Yes, we know we need the calcium, but the calcium, giving the calcium alone is not effective for addressing the potassium. You want to go to the root of the matter. The root of the matter or the problem is the potassium is in the cell. The potassium is elevated and you want to get rid or lower that potassium. So you give the insulin to drive it into the cell. Go back to this one. The problem here is that the patient is preeclamptic and the patient is on magnesium sulfate. That is causing the patient respiration to be depressed. The patient also has absence in their tendon reflexes. So the problem here, we need the calcium, but what is the priority? What is the priority here? The priority is this, because this is going to reverse whatever is going on and get your tendon reflexes back. This is going to help with your respiratory rate. The first action is to go ahead and stop the infusion. But the priority always addresses like the pathophysiology. What is the thing that you need to do to to reverse whatever is happening. Same thing here. The first action, what would be the first action for this client? What would be the first action based on what is here? So you have this patient. What would be the first action based on this question you're thinking? The best action, it would be, the best action would be the best action for the first one would be to stop. The first action would be to stop. So for this one, what would be the first action? The first action, IV insulin dextrose, okay. Never says B, Queen says B. Live, laugh, love. What would be the best action? B. So I would say B, just because with the potassium being so high, this is lethal for the patient. This is lethal for the patient and can, I'm just recognizing the cues. Exactly, Ziggy. Exactly. So this is lethal for the patient. So if this is elevated, we know that, yes, the patient needs the insulin and the dextrose. There is a arrhythmia problem here. So the best action is to go ahead and try to protect the heart. The best action is to protect the heart. So you want to go ahead with your calcium. But if you are looking at the priority, what is it the patient needs to lower this potassium? It's not calcium. The patient don't need calcium to lower this potassium. The patient needs the insulin. Yes, Kelly. Niche, okay. So if you reason it like that, where you're looking, just think of it. The condition that they give you, and if they ask your priority, go back to the drawing board and think of the pathophysiology. What is it that I need to do to correct whatever is going on with their... Yeah, we get to that shortly. So the correct answer is C. What is needed to correct whatever is going on for the patient? That is what your priority is. Your first action is, just think of it. You have a patient that is dying. What is it that you're going to be doing? Chest compression. You're going to get onto that. All right. It's the same thing. You have a patient that is, short of breath. You put the head of the bed up. That's your first action. But the priority for that patient with the shortness of breath is what? You can put the bed all the way up, but that is not going to help with the patient being short of breath and needing that oxygen. The priority is what? The oxygen. So if you have an answer or a question that says the patient is feeling short of breath, and you have one and it asks you what is the best action or the first action, and you have the option of starting oxygen, put the head of the bed up as the options, then the first action is what? The first action is that you're gonna, move the head of the bed up. But what is the priority? Giving the oxygen. When would the calcium be? When would the answer be calcium gluconate? If there's no, that if there is cardiac effects, no. It is very important for the patient to get the calcium because of the risk for arrhythmias because of the potassium. So the patient is going to need it to protect the heart. All right. So when you're treating the hyperkalemia, it is going to be needed to protect the heart. But what we're trying to understand is we're trying to understand priority and first action. So the patient is going to need the calcium either way because the potassium is high. But when you're thinking about, when it says the nurse should prepare to give, think about you have the patient with the potassium and it's elevated. What is it that you need to do to drop that, that potassium? You have a patient that is hypoglycemic. What is it that you need to do to correct the hypoglycemia? You need glucose. Okay, so live, laugh, and love. You say absolutely not. What I learned in school, it's supposed to be B. Okay, you're saying it's supposed to be B. Even online sources says it's B. Okay, all right. Try and just rationalize it, and then from there. That's all I'm saying. Try and think of it and see how you'd go about with answering. So there are different questions. How they formulate the question is going to be either first action, best action, or priority. If it is too much potassium, you give antidote, which is calcium gluconate. Okay. C is a priority based on the answers there. Because as I say, if you give calcium now until tomorrow or until the end of the year, the potassium number is not going to be addressed. And that's just it. So you can read on it a little bit more and try to understand it. Use hypoglycemia scenarios, use hyperkalemia, the same potassium here scenarios. And then from there, you look at how it is rationalized, and then hopefully you'll be able to answer the question. All right, so C is the answer. Insulin and dextrose rapidly shifts potassium into the cell that is most urgently needed. So you go ahead and grab that. Dextrose ensures the patient won't become hypoglycemic. Exactly. Open up the cells in the potassium cells. Dextrose, magnesium is antidote. Yes. A patient with acute asthma receives albuterol nebs, but wheezing decreases and breath sounds become silent. What does this indicate? A, the medication is working. B, the airway is closing and respiratory failure is near. C, dehydration, or D, normal recovery. So B, the airway is closing and respiratory failure is near. B. Okay. Yes. So B, silent chest, is showing that there is worsening symptoms or signs, which is impending respiratory arrest. So you can think about prepping this patient for intubation. Medication is working? No. Because if the medication is working, then you wouldn't have, your silent breath sounds. Dehydration, normal recovery out of it. Which assessment shows incubation? I think you meant intubation, FK. No, it's not normal recovery, Cleof. Not a normal recovery. So you have a patient that receives albuterol nebs. We know that albuterol is to help with the wheezing. It's supposed to cause is what? It's supposed to free up the airway. So you're supposed to be hearing breath sounds. So if you're giving a patient albuterol inhaler and it's not causing that bronchodilation, and the patient was wheezing, now you're not hearing anything. The chest is silent. That is a problem. Okay, so review that one as well. Which assessment shows worsening left-sided heart failure? A, jugular vein distension. B, pink frothy sputum. C, weight gain. Or D, hepatomegaly. B, frothy sputum, frothy. Oops, it's me, it's her. Welcome. Wagwan. So which assessment shows worsening left-sided heart failure? Jugular vein distension. How do you identify? How do you know when a patient is in left-sided heart failure? How do you differentiate between the left-sided and the right-sided? Let me hear about the left side. Tina, welcome. Niche says the lungs. Okay, lung congestion. Haley, welcome. Thank you for the follow. Lungs, left back up in the lungs, yes. So L for left-sided lungs, and right is for the rest of the body. Siggy, yes. It affects the lungs. Yes, nice. So based on what is here, all of these. Jugular vein would be the rest of the body. Weight gain, hepatomegaly, abdomen. So B would have been respiratory or lungs, pink frothy sputum. So pulmonary edema is a left-sided heart failure manifestation. Oh, you're on break? Okay. And then we'll do this number 10, and then we'll do one case study, and then from there. Which condition require droplet precautions? A, influenza. B, measles. C, pertussis. D, meningitis. And E, chicken pox. Which condition require droplet precautions? Select all that apply. Remember, for your select all that apply questions, Treat each answer as a true or false. And then from there, you have 5 options. At least try and find 2 out of it. If you can find 2 that you're confident with your answer, then that's a plus. You just leave it as that. Don't try and be like, overdoing it. Because when you choose more than, you lose marks for it. But if you have 5 options, don't just choose one like Vindy. I say Vindy only choose 1. Try at least find 2 that you're comfortable with, and then from there. So the Kelly says DC, ABC, okay. Partial credit. Yes, partial credit for. So just think of them. You get a point for each answer that you choose. And Millie says all of the above. So ACD is most appropriate. You have influenza, pertussis, and your meningitis. Droplet is for your flu, pertussis, and bacterial meningitis, and airborne is for your measles, chickenpox, and which other one? It's not there, but which other one could go under airborne? India says TB. What's TB? Jasmine? Yes. What's TB? Tuberculosis. Thank you, Lillian. I asked just because some persons are in the chat and we type in. Yeah, man, we type in and we probably don't even remember what exactly it is. Because sometimes I'll ask, okay, what is TPA? And some persons don't remember. Yeah, so tuberculosis. That would have been airborne. All right, let's try and see if we can tap up the live. Tap up the live, share up the live as well. That would be nice. And feel free to go ahead and follow me on TikTok as well as on YouTube at Think Nursing, one word. If you haven't followed us yet, I'd love that. We join or we do classes on Tuesdays and Thursdays at 7 p.m. Central Standard Time. I do pop in on other days, like today, and we'll run through a few questions. And then from there, I share the full live streams are posted on YouTube at Think Nursing. So in your spare time, and if you want to go back through the questions, feel free to look at them on that page. Okay. Thank you guys for following. That's nice. All right. So we have a scenario here. We have a patient, 62-year-old male. He has a history of smoking 40 packs for the year, or, 40 pack a year, smoking history rather. He's a COPD, bronchitis type. Hi, Nadia. Thank you. So it's Think Nursing, one word on YouTube, okay? And just follow here as well. So the home medications, albuterol inhaler, PRN, lisinopril, and he takes that daily. The client complains of difficulty breathing. I can't catch my breath. So 62-year-old, 40 pack a year, smoking history, COPD, is on albuterol and lisinopril and is having problems breathing. Based on your assessment, you realize that his respiratory rate is 32. His SpO2 is 86% on room air. Is using accessory muscle. Productive cough with thick yellow sputum, skin is cool, slightly diaphoretic. He's able to speak only 2 to 3 words at a time. Lung sounds diffuse, wheezing, diminished breath sounds, blood pressure 148/90, heart rate 180 and 100.9. So he has a little bit of a fever there, tachycardic, blood pressure a bit high, low onsats and respiratory rate. So yeah, a little bit of almost a hot mess, but we'll keep on going. Based on the ABG here, what ABG imbalances this patient is? What we see, does it go on objective or subjective? So what is the objective? So 1 dot is asking, what we see, does it go on objective or subjective? So your objective is what? So your objective data is your assessment, okay? What you see. And then the subjective is what the patient tell you. So the patient tell you, I can't catch my breath. That's the subjective. But if you realize that the patient is cough, well, you assess the patient and you listen and you hear crackles. That is your objective data. So respiratory acidosis, okay. So we have a pH here of 7.31, PaCO2 of 58, bicarbonate of 29, PaO2 of 58. So we identify this patient as having respiratory acidosis with hypoxemia. So we're gonna go down to the first question. Which assessment finding indicates the patient is experiencing a COPD exacerbation? So which assessment finding indicates that the patient is experiencing COPD exacerbation? Select all that apply. A, the fever of 100.9. B, accessory muscle use. C, the PaCO2 of 42. D, yellow thick sputum, heart rate of 50, or the respiratory rate of 32. So Jenny says B and C. So which assessment finding is saying that this patient is having a COPD exacerbation? Millicent says A and D. Okay. BFF, BDF, Holy. Hi Chang, how are you doing? B, C, and D. B, C, and D. Okay. Oh, come and kiss mommy. Why your face looking like that? Do you need a spanking? Hello. Go to your bed. Take off your glasses and go to your bed for me, please. And fix your face. Thank you. Okay. So B, C, all right. So let's go to, all right. So if you have a patient in COPD exacerbation, fever, accessory muscle, PaCO2, yellow, fixed sputum, heart rate, respiratory rate. So probably F. B, C, D, F. Thick yellow sputum and a heart rate of 50. Let's look at so F is gonna be a part of it. So F is gonna be a part of it. So think of it: A, fever. B, accessory muscle use. Is this normal? The PaCO2. What's the normal PaCO2? Oh yes, Daniel. It's a select all that apply. So the PaCO2. PaCO2 is normal, so that is not indicative of, the patient in acute COPD exacerbation. Fixed yellow sputum, and you have the heart rate here of 50. This patient is bradycardic. Is that something that I thought this is nursing clinical indications? So the respiratory rate, so the COPD, which assessment finding indicates that the patient is experiencing a COPD exacerbation? COPD exacerbation and heart rate, how do you correlate those? This patient is bradycardic. And even so, like, how will you correlate that? The patient is tachypneic here. So the patient is short of breath. We can see with that the COPD, a drop in CO2. Okay. So the typical patient would be, if you have your respiratory rate elevated, more than likely they're tachycardic as well. We'll have the yellow thick sputum because they said bronchitis. Remember, they said bronchitis. The PaCO2 here is normal. If a patient is having COPD exacerbation, difficulty with breathing, more than likely they're using some, accessory muscle there. And as I said, the patient is a bronchitis, so the low-grade fever is a given as well. So the A, B, D, F, fever and thick sputum, likely an infection trigger, tachypneic. And accessory muscle use is just indicative of increased work of breathing. So as I say, the heart rate here is a little bit bradycardic unless it was elevated or it didn't make mention of the patient being on a beta blocker. So we won't read too deep into it. And then if you look at the value here, this is the CO2, it's normal. So we'll just move on from that one. I have asthma and bronchitis. Okay, Millicent, sorry to hear that. Oh yeah, but it's just saying what are some of the signs or what are you expecting? Which assessment findings indicate the patient is experiencing a COPD exacerbation? So even though it is expected, if you have it on the listing there as a part of your answer, just go ahead and put it with it. If you're confident about your answer. If you're not, then don't put it because you lose mark for that. Okay, so this is a priority question. Which intervention is the nurse's priority? Remember, this is a COPD, a patient, bronchitis type. You have what? Okay, let's go through this and then we'll go through. So they encourage the pursed lip breathing. B, apply 2 liters of oxygen via nasal cannula. Obtain sputum culture. And D, administer scheduled lisinopril. So this patient, we're talking about priority again. Which intervention is the nurse's priority? A, encourage pursed lip breathing. B, apply 2 liters of oxygen via nasal cannula. C, obtain sputum culture. Or D, administer your scheduled lisinopril. So Siggy says A, encourage pursed lip breathing. Then we see B, 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 B. Nice. What the patient have. So the scenario here is a COPD, a patient, 62-year-old, 40-pack year smoking history, bronchitis type. The patient is having difficulty breathing. The oxygen saturation is 86, tachypnic at 32, slightly cool and diaphoretic, productive cough with thick yellow sputum, able to say 1 and 2 or 2 to 3 words at a time. And they also have a fever with diffuse wheezes. So we're at the priority. Oh, the priority is still which one? I see a lot of persons says B. Okay, why are we choosing B? Why are we choosing B? Apply 2 liters of oxygen via nasal cannula. Why you choose B? COPD, their drive to breathe is for the oxygen. Maintain sat between 88 to 90 or 92. 92 can't, yeah, 92 it is. It's 86, that's why B. Okay. So we're back to the same thing. The priority is what? Because I see some person says A. Boo Bear says A. Pursed lip breathing. So, okay. So let's go back here. So you have your apply 2 liters of oxygen via nasal cannula, and then A, encourage pursed lip breathing. So what is it that the patient definitely needs to help with all of those? The low sat, the respiratory rate. This is a priority question. So go back to the drawing board with your COPD and your pathophysiology. The patient has bronchitis. What is it that this patient needs based on the fact that the patient is short of breath? The oxygen saturation is low. The priority is getting that oxygen on board. If you had this patient, you're at the patient's bedside and they ask you, what is the nurse's first action? And you have encourage pursed lip breathing, or you have elevate head off the bed. Remember, first action are things that you can do like on the spot. You don't need like an order to do first action. You're using a critical thinking to say, okay, then you know that this patient is dying. Let me pull put the head of the bed up. Let me stop the magnesium. Let me get this patient connected to the cardiac monitor, because we know that the patient has high potassium and the patient is going to be at risk for, the lethal rhythm. So what is it that you need to do on the spot there? It's going to be best action, first action. Priority is going to talk about what is that one thing that this patient needs to know. You have a tension pneumothorax patient and the patient is in front of you. What is it that patients need right now? We need to do a needle decompression. That is your priority. So think of it like that, and then from there, I have asthma. It's hard to encourage people to breathe on their own. Exactly, it is. So with O2 of 86, my priority is to give oxygen. Exactly. So the priority is to, what is that life-saving measure that you need to do now to address whatever is going on for the patient? You can tell a patient, oh, go ahead and take some deep breaths. You put them into the tripod position, the pursed lip breathing. All of those are things that you can do. First action. to help out the situation in the meantime. But eventually, the priority is what is going to address that, the underlying pathophysiology. So B is the answer here. So oxygen stats are critically low. Start low flow oxygen in the COPD patient to avoid suppressing this hypoxic drive. User 4997C. Obtain sputum culture. Yeah, that's not priority. That's not priority. So obtaining sputum culture is not priority. Administer schedule, listen up, real, not priority. So just think of it. So the first thing you do is, if you were supposed to do first action, you tell the patient, oh, go ahead and do some, the pursed breathing, or you put them in the tripod position just to help with expanding, or things like that. But if you're gonna be going on to priority, apply your oxygen, and then, because you can apply oxygen with patient lying flat. You understand? Because that's what they definitely need. They need oxygen. So you'll take your oxygen and you put it on your patient. You can put it off the bed up anytime. And then from there, sir, I know you can't breathe, but I need a sputum culture. Exactly. Oh, like, is the patient drowsy? We're not reading into the scenario. Oh, Avila, sorry. It says the patient drowsy. I don't remember the patient's, the scenario. No, it didn't say the patient was drowsy. It didn't say the patient was drowsy. Okay. So the sputum culture can be, can be taken at any time. Administer the scheduled medication later on, things like that. But the priority for this patient is the oxygen. Then you have this one. We're going to go ahead and put them in the order. We're going to put them in the order of action. So they'll place the following nursing actions in the correct order of priority. So 1, reassess respiratory status and breath sounds. Let's go back to the scenario here. COPD, a person 62 years old, 40-pack years, smoking history, bronchitis type, is having shortness of breath, tachypneic at 32, oxygen saturation 86, using accessory muscle, productive cough with fixed sputum, skin is cool, slightly diaphoretic, able to speak 2 to 3 words at a time, lung sounds, diffuse wheezing and diminish at the bases. The patient is febrile at 100.9, tachycardic at 118, and blood pressure 148/90. And we said the patient is in respiratory acidosis with hypoxemia. So we are gonna put these in the order of priority for this patient. Your nursing action. So you're alone on the floor. How are you gonna go about with taking care of this patient? 1, reassess respiratory status and breath sounds. 2, administer albuterol nebulizer. 3, apply nasal cannula, oxygen. 4, notify the provider. And then 5, draw sputum culture. Let's see, 3, apply nasal cannula, oxygen. 2, administer albuterol inhaler. Then 1, reassess respiratory status. 4, notify the provider. And then 5, draws, 5, then 1, then 5, and then 4. Bite size say, maybe albuterol first, because if the oxygen is on, it can't go. Can do albuterol. Well, if they have a nasal cannula in, you can do the albuterol. Just that, the nasal cannula, the prongs are probably going to take up a lot of space there, so you won't get enough or adequate amount of oxygen going at that time. Carousel says 3, 2, 1, 5, 4. Okay. Thank you for sharing up the live, Yellow Crown and the dog, I think. Keep it up. Welcome. Keep it up, says to start by reassessing. Okay.